Is healthcare shoppable? According to this McKinsey study, 73% of US commercial claims are shoppable. And mind you, commercial claims account for much of hospital revenues and profits in the United States. Promoting healthcare shopping would have substantial implications for hospitals across the spectrum. Needless to say, hospitals are going to resist this tooth and nail because they've mostly grown on the back of raising rates and bumping up pricing arbitrarily and surreptitiously. It is like asking a lazy, spoilt brat to start working hard again on the subjects that he hates the most, probably math or physics. It's unlikely that we're going to see a change in hospitals' behavioral patterns when it comes to pricing. However, just imagine that even if 1 in 3 commercial insurance members, 30%, begin to shop, and somehow if this was available, and patients could reasonably shop for about 20 to 25% of all the commercial claims, this will have a substantial implication and will demonstrate the potential to transforming healthcare in ways we cannot imagine if pricing transparency can be implemented either via regulation or self-regulation on the part of hospital boards and governance. A new age of hospital shopping could represent a paradigm shift for insurance companies, for hospitals, for pharmaceutical companies, and definitely for patients and consumers. I expect that the uptake may be faster in certain categories like physician appointments. It might be slower, maybe in scheduled surgeries. And more importantly, either hospitals, which to me seems a bit unlikely, but the insurance companies have an incentive in this. And if they make meaningful investments in consumer-facing analytics, great digital experience, beautiful, user design to empower widespread adoption of shopping platforms, this can be transformative. The research that I showed you makes two things abundantly clear. There is substantial consumer demand. There is trust deficit with hospitals, and a significant number of hospital services are shoppable. Many of them are undifferentiated, and there is no way hospitals can justify the 10x or more variance in pricing across and within networks. If price transparency rules can be implemented, it will catalyze a new wave of innovation to meet this latent and pent-up consumer demand. The impact of these rules could be profound. It might not be a panacea for all the problems and market inefficiencies that we witness in our healthcare across the globe, but it'll be a great start.